for the COVID-19 came, it was initiated by the government, and the Public Health Institute was consulting it, and public agency was developing the app, and then a few months later, the data protection service or agency came and said this is not like protecting the personal data in the right way. So this shows that we haven't solved this yet. At a very critical point, the government that is creating the regulation and is protecting, and it is good that it's protecting the personal data, didn't manage to fulfill its own expectations to protect the data. This had another side, that a lot of data that were already collected, including my data, that was in this case very aware that okay, I might be sharing more than I usually do, but I contribute into research in addition. But also reducing the pandemic. All this data had to be deleted and not be used, and this also impacted the trust of the society to this app, because the problem was solved. Another application came later, another app. Also, technology and Google and Apple joined together forces to solve this problem. So there was a new app, I think, using this technology that was fulfilling the personal data protection requirements. But then the damage was already done for the part of the population. They have already lost the trust to this way of tracking contacts and protecting from COVID-19. So to my experience and my understanding, this problem is not solved, but there is a solution, and this I often hear colleagues, it's not my expertise, but I often hear colleagues at SINTEF discussing about privacy by design. And this is something like when we design new e-health services, digital health services, we shouldn't like try to solve the problem, just try to solve the problem and think of privacy afterwards. Something that we will add afterwards to fulfill some requirements, but this should be from the very beginning there in the design of the health service. Thank you.
Yeah, I agree. Yeah, it's just like what we always talk about, cybersecurity by design for system as well. Yeah. We have Nita, one of our guests, who put up her hand as well. Nita, are you able to unmute yourself and? Nita? No, or maybe you move on to Peter. Peter, you put up your hand as well.
Thank you. Unfortunately, I have a slight webcam malfunction, but I thought that I have some thoughts. We do spend a lot of time working with privacy and security with the hospitals. And one of the things that we are experiencing is that the future represents some new challenges, because a lot of systems are increasingly moving to the cloud. And if you look at this traditionally from a hospital security perspective, you generally have kind of the electronic health record has been the holy grail. And you've spent a lot of time kind of putting them in a vault and walling them off from internet and being very concerned about this data. And suddenly you're working with deep integrations from the cloud. And this raises a lot of challenges that are only going to be more complex going forward, because you need to figure out a way of doing this without having a system that's so fragile that compromising one third-party system will compromise the entire system. We notice this because we are able to pull a lot of data from the hospitals. But that also means that if our system is compromised, you would basically have access to a whole treasure trove of data, which is kind of the downside of having very deeply integrated systems. So having a way of doing that in a secure manner is something I think will still represent challenges, particularly from a system-wide thinking about security. And there are also, I see that what we have done with a lot of things, particularly, for example, the blood sampling project that we're doing with Roche, is also working a lot with de-identification, because at least some of you from Europe will know the Schrems II ruling from the European Court of Law, that basically it's fairly complex now to process European personal data in the United States. And part of how we solved that was extensive work with de-identification. So it's still processed in the US, but it's considered within an acceptable risk because we strip a lot of the identifying information, so they don't really know what they process, and then we reconnect it when it returns back to Europe. So that's one way of kind of working with things. But there are some very interesting challenges with the trend of moving to the cloud and making systems that make sure that compromising one system doesn't compromise the entire hospital security, which we spend lots of time working on. But it's, for those who like complex problems, it's an interesting problem.
Yes, actually in Singapore, de-identification of data is also one of the way that we actually enable the research and also the implementation of certain tests here. Unfortunately, we don't have time for another question, so I would like to close here. I would like to thank all the speakers and all listening in today because you are concerned and key to contribute to the future of healthcare. We bring together all the experts today, but this is not the end, but still a journey for us that we need to travel together and continuously learn and help solve the challenges we had ahead of us. Thank you all for your attendance, and do write to us if you have anything that Innovation Norway can help in this journey.